This country is gripped by a sad reality that death by opioids continues to rise. Joining us with more on this epidemic is Dr. Christo, chronic pain and opioids abuse expert. And you're also a Sirius XM host and best-selling author. It's good to see you again.
Thank you very much.
So included in the opioid pandemic, in the epidemic, I should say, are deaths from heroin and fentanyl abuse. Knowing how dangerous all three are, why are we still seeing not just a plateau, but a rise in use and in death?
You know, I just think it's a holdover from the COVID-19 pandemic. Now we have different strains, and I think that there's still a lot of emotional upheaval and fear related to catching COVID and perhaps dying from COVID. And that's still leading a lot of people to use these mind and mood altering substances that you described. So it might be opioids, specifically synthetic fentanyl, but also we're seeing a rise in the use of stimulant drugs like methamphetamine and cocaine.
Yes, exactly. And as we've seen just in the last few weeks, some comedians and actors who've fallen prey to overdoses on fentanyl. Fentanyl has been just such a powerful, deadly drug. How is it, though, that we're hearing all of these stories, you don't know what you're getting, yet people are still taking the chance?
I know. You know, part of it is sort of this cycle that people can get into with respect to addiction. I mean, so when you think about addiction, what we're looking at here is you're introducing a drug with rewarding properties. For example, maybe illicit fentanyl, could be cocaine, to a vulnerable person at a vulnerable time in life. Well, I mean, the COVID-19 pandemic has led to a lot of vulnerability, and we're still seeing that now. We're still seeing a lot of vulnerability on the part of many in the population. What surprises me is that we have physicians and other healthcare providers that are writing opioid prescriptions for chronic pain, because frankly, the data that I've seen from, say, the American Medical Association has indicated that there's been a 40% reduction in prescription opioids over the last, say, 5 to 6 years. And primarily because we realized several years ago that, boy, we were prescribing too many of these, and we shouldn't prescribe them as a first-line agent. Mm-hmm. So really, the data that I've seen suggests that people are overdosing on opioids because they're buying illicit opioids from the market, like illicit fentanyl.
Okay, well, in 2018, this is just a statistic that I found, and maybe you can debunk it, but 2018, South Carolina providers wrote 69 opioid prescriptions for every 100 people. That's compared to the roughly 51 prescriptions for the rest of the nation per 100 people. So it sounds like it's on the rise. It doesn't sound like it's dropping.
Well, agree, based on what you're describing to me. Agree. And, I don't know if it's that there are, well, the other problem here is that we have a huge crisis related to chronic pain that we don't hear much about, frankly. We hear about the opioid crisis, and I understand why. But the flip side of this is that we have over 100 million people in this country suffering from chronic pain, mostly that's unrelieved. And so it could be in part that we're struggling still to help treat patients who have chronic pain whose lives are disrupted.
Yeah, and from a professional standpoint, what are some of the other ways to deal with chronic pain? Because going back to the providers, well, they should know if there's a holistic approach, if there's other ways in which people can be relieved of their pain or perceived pain.
You're right. I mean, they should know. Well, first of all, we have a scarcity of basically pain specialists in the United States. So that's sort of problem number one. Two is, I do agree, they should know. And there are a host of other ways to treat chronic pain. Namely, we have medications that are non-opioids, right? Like anti-inflammatories, ibuprofen, for example. But we have others. We have anticonvulsant medicines. We have specific analgesic antidepressants that we use for pain control. Not to mention the fact that we have a host of interventional procedures, right? Certain nerve blocks, joint injections. I mean, we even have spinal cord, we have neuromodulation procedures that are really fascinating that can help reduce pain, and integrative therapies like acupuncture.
Right, exactly. Some Eastern medicine thrown into the mix.
Yeah.
Finally, I wanted to ask you more about telemedicine. Again, specifically to South Carolina and states like South Carolina, it's difficult for a lot of people to go and see their doctor. So telemedicine has really become so very important and useful in these cases. But how do you go about using that technology to help people with their pain and to avoid opioid addiction?
Well, we've certainly seen a rise in the use of telemedicine due to the COVID-19 pandemic. No question about it. I think it's been very useful. More and more people can access it in the cities, in rural areas of the country. The American Psychological Association has a great website. It's a locator for those who are in need of addiction services. You can look up therapists, counselors, psychiatrists, and it's regional. Mm-hmm. So I think, number one, make sure that if you can access that website for help if you need it, if for some reason the primary care physician or provider isn't available.
Okay, and finally, how do addicts fight those addictions? Where is the first place you would recommend that they go?
It's really tough. I mean, addiction is really tough to overcome. I think, first of all, substance abuse treatment centers are key. I think often, first of all, we don't have enough of them across the country, unfortunately. And frankly, the Sacklers, I think, had to pay, $4.3 or something billion for their responsibility in the opioid crisis. I think we should use those funds to help fund greater access to addiction services.
Dr. Christo, thank you so much for joining us today.
My pleasure. Thanks for having me.
We're back after this.